Hi, my name is Barbara. I'm a nurse from the pre-admission testing department here at the Institute for Orthopedic Surgery, and I was asked to discuss some helpful information regarding your upcoming joint replacement surgery. Regarding your stay here at the Institute for Orthopedic Surgery, we have a 12-bed inpatient unit. Each room is a private room. Our visiting hours are from 9 a.m. to 9 p.m. If you have any special dietary requests or needs, please let us know. Most of you will be here between a 1 and a 3-night stay, and while you're here, you're welcome to wear the hospital gown that we provide, and we also have robes. However, a lot of our patients do choose to wear their own clothing while they're here. So if you're having a knee surgery, please make sure you wear something that gives us easy access to your knee. So for the ladies, a pajama gown or shorts is definitely the best choice. For the gentlemen, shorts, pajama shorts, gym shorts is the best choice for knee replacement surgeries. Keeping in mind that these are clothing that you will be wearing out in the hall when you're doing your exercising. If you're having a hip replacement surgery, just anything that's loose, easy fitting, stretchy, that can go over a bulky dressing on your hip area. You most likely will not have a urinary catheter with your joint replacement surgeries. However, we are giving you a lot of IV fluids before, during, and after surgery, so you are going to have the urge to void usually 2 to 3 hours after surgery. Every single time you get up in this facility, you're going to have at least one staff member with you, and you're going to have a gait belt around your waist. If you want to go from the bed to the chair, from the chair to the bed, if you want to go from the commode to the sink, every single time you ambulate in this facility, you need to have a staff member with you. You've got to use your call light. There is a blood test that every patient that has a joint replacement done at the Institute for Orthopedic Surgery does need to have completed. The test is called a type-in screen. This blood test tells us the type of your blood, but it also makes sure that we would have donor blood available for you in case you happen to need it. Most likely you will not need it. However, it is, again, our policy that we do have this test completed. This test, the type-in screen, can only be done within 4 days of your surgery date. So it can be completed a day before your surgery, 2, 3, 4 days before your surgery, but it cannot be completed beyond that. You should have the order already at home. If you do not, please call us in pre-admission testing or call your surgeon's office and ask them for the order. You can go to St. Rita's or New Vision Labs to get this testing done, and most likely you do have the list of these at home. They do include, of course, the Institute for Orthopedic Surgery, our New Vision Lab here in-house. You can also go to Main Hospital, St. Rita's, if you'd like to go there. You can go to East Side, West Side Urgent Care here in Lima. There's ambulatory cares in Delphus and Putnam County. No appointment is needed for when you go get the type-in screen blood test. Please make sure that you do call ahead to make sure the days and the hours that these labs are open. Also, you do not need to fast. You will know for sure that you had this type-in screen blood testing done when they put a patient bracelet around your wrist. It will have your name and a bunch of letters and numbers on it. That is the code that would match up donor blood for you at the blood bank. So once you get that band on your wrist, you need to leave it on your wrist. Moving on, you do need to let your dentist know that you've had a joint replacement surgery, because you will need to be put on a prophylactic or preventative antibiotic. The goal is to help prevent the spread of the bacteria in your mouth through your bloodstream to set up, that could possibly set up an infection in an artificial joint. This is usually just a set of antibiotic pills ordered by your dentist that you would take 1 hour prior to your cleaning or whatever the dental procedure is, up until a minimum of 5 years after your surgery, possibly for the rest of your life. Blood clots are a risk with total joint replacement, so there's a few different things that we do to help prevent them. The first is the exercises that our therapist will review with you. The second thing that we have you do is wear the thigh-high compression stockings. What they do is they provide a tight compression onto your calf area so that the way your blood cannot pool and then potentially clot. You will be wearing TED hose for a very minimum of 4 weeks on your operative leg and a very minimum of 2 weeks on your unoperative leg. You do need to take good care of your TED hose. Make sure you hand wash them and let them air dry. If you have a second pair of TED hose from a previous surgery, get them out, wash them up, and you can use those as a backup pair. If you're having a knee replacement surgery and you only have one pair of TED hose, the time to take them off is at nighttime when your legs are elevated rather than when they're down during the day and more likely to have swelling. For the people that have knee replacement surgeries, you're not permitted to put tape on the knee area to hold your dressing on. The TED hose will be what holds your dressing on. So when you take your TED hose off, you need to hold your dressing onto your knee with an ACE wrap during that time. The next thing that we do for blood clot prevention is have you wear a sequential compression device. These go in your calf area and they attach to a machine at the foot of your bed. These are only used while you're here in the Institute for Orthopedic Surgery and only while you're in bed. You won't be going home with them. But they pump up with air and release, pump up and release, and they just help facilitate blood flow to your lower legs. Finally, the last thing that we do for blood clot prevention is medication. There's 2 different drugs that we use here. Most commonly, people are receiving Xarelto. Xarelto is a pill. It's a blood thinner that helps prevent against blood clots. It starts 8 hours after surgery, and it's just given 1 time a day, typically for 7 to 14 days, possibly longer depending on how your surgeon has it ordered for you. There may be instances where Lovenox would be a better choice for you. Lovenox is an injectable. It's a shot that's given into the belly. If you are prescribed Lovenox, we will instruct you or whoever's giving it to you on how to administer this medication. You each are going to be seeing a physician for medical clearance prior to your surgery. It may be your family doctor, it may be a cardiologist, it may be an internal medicine physician. Please, when you see this physician prior to your surgery, make sure they have a list of all of the medications that you take, including supplements. As a general rule, 5 to 7 days before your surgery, we have you stop non-steroidal anti-inflammatory medications such as aspirin, Motrin, ibuprofen, Advil, Aleve, naproxen, Mobic. That is not a complete list, it's just a partial list of the most common non-steroidal anti-inflammatories. Also, 5 to 7 days prior to your surgery, you should stop taking vitamin E type supplements, and that includes fish oils, krill oils, omegas, Lavazza, for example. And you should stop taking herbal supplements such as glucosamine, chondroitin, MSM, echinacea. All of those medications and supplements that I just talked about can increase your risk of bleeding and bruising. That's why we have you stop them prior to your surgery. Also, if you're diabetic, or even if you're not diabetic, but you take glucophage or metformin, that does need to be stopped 2 days or 48 hours prior to your surgery. 12 hours prior to your surgery, we want to make sure that you do not eat anything. You will be permitted to drink water up until a certain period prior to your surgery, typically within 2 to 4 hours. When my department pre-admission testing calls you a few days prior to your surgery to review your instructions, we will tell you what time you need to start your fast and what time you need to stop drinking water. The only medications that you should take within the 12-hour window prior to surgery is blood pressure medications, heart rate or rhythm type medications, seizure medications, and respiratory medications such as inhalers, for example, for asthma. You should bring all of your home medications with you in their original pharmacy containers. We will keep those medications locked up at the head of your bed, and we will dispense your maintenance medications from the original bottles. Also, if you have sleep apnea and you have a CPAP or BiPAP machine, you do need to bring that in the day of your surgery. If it takes distilled water, we have that here. Thank you for watching this video today. If you have any questions at all, please call us at the Institute for Orthopedic Surgery.